This is a review of innervations of the median nerve. So just distal to the elbow, we've got innervation of pronator teres, then flexor carpi radialis, palmaris longus. We also have innervation to the FDS, and then there's this bifurcation of the median nerve. The AIN is a motor branch, and it's going to innervate the radial FDP, flexor pollicis longus, pronator quadratus, and then it's going to continue distally to innervate the joint capsule. If we go back to median nerve proper, it continues distally. There's the palmar cutaneous branch that's proximal to the carpal tunnel, gives you sensation to the palmar area. And then distal to the carpal tunnel, the median nerve gives rise to the motor recurrent branch, innervating APB, FPB, and then the opponens pollicis. We also have innervation to the radial lumbricals. And then these are sensory branches. We've got a radial and an ulnar digital nerve for the thumb, the index, the middle, and then the ring finger, we have a radial digital nerve.